Hello, so who told you that a woman of 40 and above cannot have their own children, cannot give birth naturally without any assisted reproductive technique? Okay, come closer, let me tell you. Now, a woman of 40 and above or from 35 and above can give birth naturally without any assisted reproductive, technology. Without any assistance whatsoever. Yes, plenty women has given birth for the first time without any assisted reproductive technique. And this plays a role on their lifestyle factor and how they live their life and how they have preserved their life. I know there are certain things that plays a role in a woman's fertility. Yes, age is part of it. Of course, declining fertility comes with advancing age. As you're advancing in your age, your fertility is declining. Of course, your fertility cannot be as high as it was when you were in your 20s. Immediately you hit 30s, there's a decline. Then from 35, there's a sharp decline. Then 40, there's another sharp decline until you reach your menopause. But that doesn't mean that a woman of 40 cannot give birth on her own, conceive, naturally give birth without any assisted reproductive technique. So my name is Nurse Valerie. I'm a registered nurse midwife and a certified family planning care provider. So I talk about pregnancy, labor, and delivery. I talk about nursing and midwifery generally. So today I just want to talk about women and their fertility, your lifestyle and your fertility. How does your lifestyle or yes, how does your lifestyle plays a role in your fertility or the way you live your life? What's the impact of your lifestyle in your fertility? You know, let me take for instance, from the age of 30, a woman should make a conscious effort to cut down on certain things that she does, except you don't want to have a child. If you're a lady and you're not planning of giving birth, this video is not for you. If you don't want to have children, this video is not for you. If you're not planning of, establishing a family in the future, this video is not for you. But if you are a lady and you're thinking of giving birth in the future, you want to have children, you want to, have children in the future, then this video is for you. From the age of 30, you just have to make some adjustments in your lifestyle that will benefit you. You have to think about yourself, especially when your partner doesn't care. Do you understand? Most things are happening nowadays. You may not know. You may be dating somebody and you don't know that the person doesn't not even want to settle down with you. And you keep having abortion, keep taking contraceptive and all that. Are these things playing, are these things good for your health? This lifestyle are impeding, they are not good, they are not healthy for your fertility as a woman. So these are the things you're supposed to think about. So you're doing recurrent abortion. Your partner is making you to undergo some recurrent abortion. And abortion has its own complications. You can have pelvic inflammatory disease. You can have a blocked fallopian tubes. You can have a damaged uterus. You can have septicemia from unsafe abortion and so many other things. Are you thinking about these things while you're in that relationship that is not or may not even progress to marriage? So these are the things you have to think about. Am I being fair to myself? I want to have children in the future. What is this man's plan? What is this guy's plan for me? I'm not getting any younger. I'm 30, I'm 35. So why will I be doing this at this age? These are the questions you need to ask yourself because you're not being fair to yourself. Men and women, their lifestyle are not the same. A man of 60 years can still pregnant a woman, but a woman of 60 years cannot naturally get pregnant on her own except God's intervention from heaven. Yes, we have to be realistic. So you taking contraceptive, the second one is taking contraceptive. At that age, from the age of 30, you're taking contraceptive. Ah, sister, why now? You're still taking contraceptive. You are 35, you're still taking contraceptive. Your has declined though. Remember that contraceptive works on your hormone. It's stopping your hormone, it's reducing your fertility level. It's preventing you from getting pregnant. And some of these hormonal, some of these contraceptives, they have side effects. Yes, they have side effects. They have their own advantage, they have their own disadvantage. It's not like you have children, okay? I'm taking this to space because I have two children. I have one child. I want to space before I have the next. This that you don't have any and you're planning to have in future. So now you're 35 and your age is going down, is going up, your fertility is going down, and you're still using something that brings the fertility down. Think about it now. Do you think it's a wise decision for you to keep such attitude or habits ongoing while you are at that age? Okay, so I think I will cut this video here. See you on the next part of this video. Okay, so this is the second part of my previous video, the discussion, what I was discussing on the previous video about women and their lifestyle, their fertility, age, and all that. So if you want to know the details about this video, you can watch the first video, then this is the second video. So I was talking about women, their age, how age affects your fertility and how your lifestyle also affects your fertility. These two things plays a key role in your fertility. So I was saying that from you can be 30 and between 30 35 going, forward, and you'll be living a life of somebody like that is 2025. Are you being fair to yourself? Are you being fair to your fertility? Are you being fair to your health? You can't be, partying, taking alcohol, taking caffeine, taking smoking at the age of 35 years when you are having this, you're planning of getting pregnant. You want to have a child, unless you don't want to have a child. If you don't want to have a child, okay, this video is not for you. If you don't want to have a child in the future, this video is not for you. But if you want to have a child, you need to make a deliberate effort. You need to be conservative about your fertility. You need to conserve your fertility. You can't be, you know, indulging in heavy alcohol at the age of 35, knowing that all those lifestyle doesn't go down well with your fertility. You can't be smoking at the age of 35 and above, knowing that that attitude is not really healthy for you at that age. You can't be, you know, addicted to caffeine in such a way that you take it so much that you know that this thing I'm addicted to it is not really good for my health and my fertility. You can't be taking junk carbs. You can't be taking sugars, living on healthy lifestyle when you know that you are planning of getting married, having children, in the future. You don't want to get there and start fertility treatment. You need to make a deliberate effort from the beginning about your fertility, about your health. You can't be, you know, in that relationship that is giving you recurrent infection when you are thinking of having children. Remember, those infections can block your tubes. It can block your tubes, give you pelvic inflammatory disease. And you keep treating and treating and treating, and you're thinking of having children in the future. Are you thinking wise? Are you being fair to yourself and your fertility at that age? No. So those are the lifestyle that you need to cut down. Those are the things that you need to cut down. You need to engage in active or passive exercise. Go to the gym. You need to rest. You need more rest. You need more sleep. You need to take supplements that boost your fertility. You need to start going to the hospital. Yes, start going to the hospital. Go for checkup. At the age of 30, 35, girl, go for checkup. No, what is happening? If you live an active lifestyle during your 20s, immediately you clock 30. See, I'm telling you this secret. If you were active in your 20, very, very sexually active when you were in your 20, now that you're 30, 30 something, 35, 36, please go to hospital. Start doing some hormonal profile. Check yourself, check your womb. Do you have blocked tubes? Do you have fibroid? Do you have this? If there are things you can tackle, because early detection is very good in treatment, because you saw it early, you treat it early. So you can start the treatment before by the time you're through, you're married and bam, you're pregnant. Yes, then I don't care. I don't care. When we get to the bridge, you cross it. By the time you get to the bridge, you're pressured. Now you're not under any pressure. You're not under nobody is disturbing you, nobody is asking you. But by the time you get pregnant, you say, I'm 36, I'm 37. then you're under pressure. You now want to treat the infection. You now want to go for surgical intervention if you have fibroid. You now want to do this, boost your hormonal level. You now discover some things that may impede or prevent you from getting or being pregnant. This both apply for both men and women, because even men, they are having, so many young men are having low sperm count, being sterile, ejaculatory failure and all that. But I'm talking more about women in this video. So, girl, you need to wisen up. Unless you don't want to have a child, then you can live your life. But if you're planning of having a child in the future, you need to make a conscious effort on how you can, you know, preserve and be fertility, aware. You have to conserve your fertility. I mean, you have to plan a way of conserving your fertility because you're thinking about your future. Do you understand? So these are the things that can help you while you're preparing to, get pregnant. But I'm not pressuring you. This video is not to pressure any young lady who is above 30, 35 to get pregnant. No, because I don't. It's better that you at the right time when you're ready, because some people, they prefer to get married at the age of 30 or 35, and it's okay. They want to achieve certain things in life. They want to be established before they get, and it's very, very okay. It's perfect. That's okay. But while you are trying to achieve certain things in life, while you're making deliberate effort to, stabilize before you get married or start having children, you have to make also a conscious effort about your health, about on how you conserve your fertility, so that when you reach that bridge, you cross it smoothly. Is it not better that way? Okay, so I think now you have you have an insight to what I'm saying. The overall thing I'm saying is that you cannot be 30, 35 and you're living a life of 2025. That 2025 adolescent and all that. At 30, you're supposed to start thinking about family, future, about kids and all that. And it's not for you to be pressured, no, but it's for you to cut down on certain lifestyle that may not really be good for your health or your general well-being. So there's a video I made on not don't be pregnant after 35. Yes. So you can watch this video. You can watch this video and know the benefits of having children after the age of 35. Even though anything that has advantage has disadvantage, but that video will teach you a lot. There are a lot to learn from that video. So you can subscribe to my YouTube channel, watch the video, and tell me what you think about the topic. So bye for now and see you next time. I hope this video is okay. You can tell me what you think. Are you in for what I said? Being prepared, being conservative about your fertility, or your team when we get to the bridge, we cross it. Everybody have their own, thing and how they do their thing. So let me know in the comment section. Thanks. See you next time. Bye.